Sjogren's can be a very tricky condition to live with, and we often think about dry eyes and dry mouth. But did you know it can also damage your nervous system and your brain? So if you want to understand Sjogren's disease, brain and nervous system damage in just 3 minutes, you don't want to miss this video. Here's what most people, and even many doctors, don't realize. Studies show that up to 70% of Sjogren's patients experience neurological symptoms, and in many cases those symptoms actually show up before the dry eyes and dry mouth ever do. The most common neurological complication is peripheral neuropathy, followed by cognitive impairment and central nervous system involvement. Let's break it down. If this sounds familiar, I've put together a symptom map that shows how this condition progresses and where standard tests often miss it, and questions to ask your doctor. Type symptom map in the comments, and I'll send it to you. Because what comes next explains why knowing your stage could change everything. Number 1. Peripheral neuropathy. Peripheral neuropathy is the most common neurological manifestation of Sjogren's, affecting around 20% of patients. It typically presents as numbness, tingling, and pain, often following a glove and stocking pattern in the hands and feet. There are 2 types to know. Sensory neuropathy affects how you feel, temperature sensitivity, burning sensations, altered touch. Motor neuropathy affects how you move, causing weakness, muscle wasting, and coordination difficulties that make writing or buttoning a shirt a real challenge. A neurologist can confirm this with an EMG, a nerve conduction study done right in the office. If this is something you or someone you love is dealing with, type the word nerves in the chat right now. Number 2. Autonomic nervous system involvement. This one is big. Sjogren's can attack the autonomic nervous system, the system that quietly runs your heart, digestion, bladder, and body temperature without you thinking about it. When Sjogren's affects the autonomic nervous system, it can cause a condition called dysautonomia, which includes POTS, where the heart rate spikes suddenly for no obvious reason, causing dizziness and poor heat or cold tolerance. It can also lead to difficulty swallowing, and when the GI tract is involved, patients can experience gastroparesis, delayed stomach emptying, along with bloating, diarrhea, and constipation. Bladder control and libido can also be affected. If the autonomic signs surprised you, type autonomic in the chat right now. Number 3. Mononeuritis multiplex. This is one of the more serious nerve complications. Mononeuritis multiplex involves severe inflammation of major individual nerves, and it can cause a wrist drop or a foot drop, where you literally cannot extend your wrist or lift your foot properly. This happens because the nerve is so inflamed it stops working. This is a medical emergency that requires urgent treatment with steroids and immunosuppressive medications to restore function. If this one shocked you, type the word serious in the chat right now. Number 4. Brain and central nervous system. Central nervous system involvement in Sjogren's most often affects the white matter of the brain, about 60% of CNS cases, and the spinal cord in about 40%. Symptoms can include confusion, severe headaches, vision changes, weakness, and seizures. Aseptic meningitis, inflammation of the protective lining around the brain and spinal cord, can cause headache, stiff neck, fever, and light sensitivity. In the most severe cases, Sjogren's can cause encephalitis, full brain inflammation, leading to seizures and coma. Transverse myelitis, or spinal cord inflammation, can cause paralysis and loss of bladder and bowel control. These conditions require MRI, lumbar puncture, high-dose steroids, and immunosuppressive treatment immediately. If the brain involvement surprised you, type brain in the chat right now.